My name is Stefan Wollnik. I'm a research associate at Duisburg-Essen University in Germany and as well a member of the research school called Midas 21. Today I'm going to present some first results from a side project of my PhD research focusing on the importance and challenges of COVID-19 pandemic reporting in Uganda and in South Africa. The research question of this little side project of my research focusing on the COVID-19 pandemic is: how do health journalists from Uganda and South Africa perceive the journalistic role during the COVID-19 pandemic, and how does the COVID-19 pandemic affect their journalistic work? In this study, I am going to focus on what journalists want to do by doing their journalistic work. Such cognitive role orientations capture journalists' individual aspirations and ambitions and the communicative goals they want to achieve through their work. Cognitive role orientations can be subdivided into 4 different roles. The first one is the accommodative role. It is characterized by a strong audience and service orientation. Journalists want to provide advice and guidance for action. The second one is the monitoring role. Journalists see themselves as the fourth estate and as watchdogs who hold those in power accountable. The third one is the collaborating role. Journalists perceive themselves as supporters of the authorities in their efforts to promote development and prosperity. The last one is the interventionist role. Journalists have a social mission and are committed to specific social groups or causes. The present study was conducted as part of a doctoral project. To answer the above-mentioned side question, a comparative case study was chosen as a study design. Uganda and South Africa were selected as comparative cases. Criteria for the selection of the comparative countries were the greatest possible difference in terms of the level of socio-economic development of the countries, the degree of press freedom according to Reporters Without Borders, and health indicators such as the extent of the spread of COVID-19 in sub-Saharan countries. The methodological approach focuses on semi-structured interviews with journalists from Uganda and South Africa who specialize in reporting on health issues. The units of study to be compared are the forms of cognitive role orientation according to Harnage and Voss from 2017, and the journalistic challenges during the COVID-19 crisis. Techniques of qualitative content analysis according to Meiring were used to scrutinize the interviews. Until now, 18 journalist interviews were conducted. More information on data collection, sampling, and sample composition can be found in the conference paper. Preliminary results: cognitive role orientations. The results indicate that the roles health journalists intend to play during the COVID-19 pandemic in Uganda and in South Africa seem to show clear parallels to each other. This is because journalists from Uganda and from South Africa emphasize above all the informing and educating role of the media, so the accommodative role. When it comes to combating misinformation, they also stress the interventionist role of the media. Moreover, monitoring the authorities does also play a big role according to the journalists. The journalists refer to the role of journalism in exposing misconduct on the part of the authorities, as you can see in the following quote. The role of supporting policy makers in managing the crisis was not strongly articulated, but is implied by the journalists' desire to contribute to the end of the pandemic through media coverage. Furthermore, health journalists also served as a source of information for other journalists who have to report on COVID-19. Challenges for journalists in Uganda and South Africa. One of these challenges is the lack of knowledge about health reporting. In times of a global health crisis, many journalists become a health journalist themselves. However, the health journalists interviewed also see this as another problem. because health journalism requires a certain knowledge about health, which not all journalists have. This is in particular true for interpreting statistics and for providing scientific context. Another challenge was the access to and the availability of information about COVID-19. In comparison to other epidemics and pandemics, there was too little new information about this infectious disease, contrary to the great public interest, especially at the beginning of the COVID-19 pandemic, which made it difficult for journalists from Uganda and South Africa to communicate adequately about it. Especially at the beginning of the pandemic, the work of journalists was made more difficult by the fact that no meaningful studies on COVID-19 were available. Instead, journalists were forced to rely on preprints. In addition, government measures against COVID-19 also made access to information more difficult, as lockdowns and travel restrictions made it almost impossible to move around the country. In case of South Africa, journalists also talked about a lack of transparency in the context of access to information, as you can see in the following quote. So if they, the South African government, feel it will suit them to make not some information public, they will be late and then they will release it when they think it will be politically more convenient to do so. Moreover, during the pandemic, journalists from Uganda and South Africa have to cope with divergent information among scientists and between scientists and politicians. Another aspect was the availability of personal protective equipment. Some journalists from Uganda also mentioned that they were not well protected during their work as journalists. They complained about the lack of personal protective equipment, which means face masks and disinfectants, against the coronavirus. So PPE for journalists is often not provided by media houses. This makes it difficult for journalists because often they have to travel to collect information, exposing themselves to the risk of contracting the virus. Another challenge was remote working. The interviews from South Africa and Uganda reported that research had to be conducted remotely, often by using telephone or the internet from home. Thereby, the journalists interviewed were also confronted with technical challenges, as well as limited selection of interview partners as sources. Only those sources that were willing to use new technologies could be interviewed. This led to the dependence from official or online sources and affected the quality of a story. Besides, because of restrictions of movement released by the government, it was hard to get stories of people living in rural areas. The journalists interviewed also reported on risk for physical and mental health. Some journalists talked about being afraid to get infected by COVID-19 when going into the field and do research for their health reporting. In addition, South African health journalists also point to health aspects in connection with reporting on COVID-19, which are generally underestimated due to the large amount of new information about COVID-19 per day, which journalists have to process and check for accuracy. Journalists often get stressed. Furthermore, especially journalists from Uganda reported a loss of journalistic jobs or cut of salaries because of economic difficulties caused by lockdowns. Last but not least, journalists from Uganda were afraid of stigma and discrimination in the newsrooms against journalists covering COVID-19 issues, since other journalists also feared to get infected by the virus brought by their colleagues. The meaning of the preliminary results. The results indicate that there are no relevant differences regarding cognitive role orientations between health journalists from Uganda and South Africa. This is because journalists from Uganda and from South Africa emphasize above all the accommodative and interventionist role of the media. Furthermore, despite focusing on health journalists during the current pandemic situation, no additional or new types of cognitive role orientations have been identified so far. With regard to the challenges found in reporting on health issues, only minor differences between the two cases can be described. Journalists from Uganda rather point to the lack of availability of protective equipment, the danger of infecting themselves during journalistic activities, and the fear of being stigmatized because of their work or of losing their job. It was also striking that the role of the government in terms of access to information was named as a challenge significantly more in South Africa than in Uganda, although Uganda scored significantly lower in terms of Reporters Without Borders press freedom ranking. Some of these challenges, such as the lack of knowledge, access to information, and the availability of PPEs, as well as some societal roles of health journalism, can be proved by prior publication focusing on the importance of health journalism during major public health crises in sub-Saharan countries. The preliminary results described here are subject to some limitations. For example, the total number of interviews conducted appears to be too low. In the further course of the research, the number of interviews will be further increased in order to increase the significance of the results and to identify further types of cognitive role orientations that are maybe unknown so far and in particular related to public health crises. Because of travel restrictions in context of the pandemic, it should be also mentioned that all interviews took place virtually. Therefore, there were often technical difficulties with regard to internet connectivity, especially in the case of interviews with journalists from Uganda. In this context, it should also be mentioned that some interview partners, often for reasons of internet connectivity, chose their public workplace to conduct the interview, which in some places led to strong disturbing noises from the interview environment and made the transcription and evaluation of the interviews considerably more difficult. Results can only be related to the role perception of journalists in case of COVID-19 pandemic and not to health journalism in these countries in general. The challenges described here offer approaches for global media development assistance. However, these do not only refer to the current COVID-19 situation, but are also transferable to the situation of health journalism in Uganda and South Africa in general. At the individual level, the level of journalists, there is a need for seminars, grants and other training opportunities in both Uganda and South Africa with regard to journalistic coverage of medical and health issues, and specifically in relation to COVID-19. Furthermore, such training opportunities should ideally run over a longer period of time, maybe over months or years, since gaining specific health knowledge needs some time. In addition, such health-related journalist trainings should also be offered to general journalists without specializing in health issues. This is because they should also be able to understand scientific issues, especially since in the COVID-19 crisis, many journalists become a kind of health journalist and some have to struggle with health reporting. At the structural level, another form of support is to invest in the establishment of specialized newsrooms or in the promotion of already established newsrooms for health journalism in order to increase the capacity of health reporters and maybe also to guarantee the supply with personal protective equipment. Besides, the development of guidelines for quality health journalism could also contribute to the development of health journalism in Uganda and South Africa in general. Thank you very much for your interest in my research.